Hey guys, thanks for popping on. Throwing a video together to talk more about CPR compression depth, specifically related to infants or babies, right? So a lot of times we're teaching these programs with pediatric, which includes infant and child. And one of the questions we get a lot of, obviously we teach to the standard of for infants about 1.5 inches deep, and for children we're about 2 inches deep. So what does that actually look like, right? Like, how do I know I'm actually pushing about 1.5 inches or about 2 inches if it's a child? So we use a visual as a rule of thumb. So in other words, if the infant or child is laying on a flat, firm surface, which they should be for CPR cycles, we want to push about 1/3 the total depth of their chest cavity. That is going to get us to that aiming point of about 1.5 inches or about 2 inches. So if you kind of really put a visual to it, we have an infant lying there, they're on a flat, firm surface, we give compressions, and we give compressions about 1/3 the depth of their chest. That's about the aiming point that we're going to look for in terms of how hard we actually have to push. And of course, we have our 3 techniques to do this. We have our encircling thumb technique, which we have another video on. We have our 2-finger technique, as well as possibly using a 1-hand technique to, again, achieve that depth of about 1.5 inches deep. We want to move the remaining bit of oxygen-rich blood in their body, and we do that through giving compressions. So hopefully you guys enjoyed the video today. Please feel free to reach out if you have any questions. Thanks.